Okay, so greetings everyone. Can you type in the comment section where you are viewing from right now? Are you from Cebu? Are you from Luzon, Mindanao? Are you from India, the UK? Start in a minute. Okay, great. Can everyone hear me? Can everyone hear me? Give me a thumbs up if you can hear me. Okay, from Laguna, Cebu, Tacloban, Capiz, Pampanga. So hello to everyone. Okay, great. So let's begin. Let me just share my slides. If you want a copy of the slides of the coaching, just type in your location there, then I'll share a link, a common link to everyone. I'll give you an open Google Drive so that you can access the files. I'm in a remote area right now, so I hope my signal is coming in. Okay, great. So let's begin. Can everyone see the slides? Give me a thumbs up if you can see the slides before we start. Just type in the chat box if you can see the slides. Just want to make sure everyone is with me. Okay. So we have some greetings from Manila, from Isabela, Tacloban, Laguna, Pampanga, Cebu City, South Cotabato. Greetings. So I guess, Davao. Kumusta? Okay, great. So let's begin in about 60 seconds. So we're going to have a clinical anatomy coaching, and I'm going to focus on the lower extremities. We'll have more sessions, which would include anatomy, biochemistry, physiology, and we'll be having some clinical subjects also within the next 2 weeks. This is in preparation for those who might have some exams, some bi-monthly or term exams, final exams, and those who are preparing for their respective licensure examinations. Okay, so magandang gabi, maayong gabi, good evening. Let's begin our coaching session. This is Doc Toom, the Med Guru, welcoming everyone, different time zones, different areas of the Philippines, and some people chatted in the chat box that they're also listening from a different time zone. So welcome to our clinical anatomy coaching. We're going to have it MedGuru CDB style. Now, don't worry. I'll give you a copy. I'll give you a printout of the slides that I'll be using. I will also give you a link to access that. I would also give you free access. You can get access to this coaching recording. You can view it as many times as you want and share it with your friends. So good evening, and let's begin our clinical anatomy coaching. Now, for this session, we're going to talk about the gluteal region, the gluteal muscles, all of the anatomic as well as surgical and clinical landmarks, the area of the thigh, particularly the muscles of the anterior, posterior thigh, their nerve supply, the clinical conditions and landmarks, as well as some pearls about the foot and the ankle. Now, I'll be using two of the most high-yield references for any anatomy student worldwide, and that is Clinically Oriented Anatomy by Keith Moore and Clinical Anatomy by Regions by Richard Snell. So I will be combining both of these two high-yield references in a very user-friendly approach that is very, very helpful to students. Now, let's begin with the gluteal muscles. Now, the gluteal muscles, there are actually 4 gluteal muscles. Now, what are these gluteal muscles? Now, first, we have the gluteus maximus. We have the gluteus medius. Then we have the gluteus minimus and the tensor fasciae latae. Now, the gluteus maximus, medius, minimus, then we have the tensor fascia latae. Now, I want everyone to remember that these are the major gluteal muscles. Now, let's talk about the first pearl you have to bring with you to any standard exam. This is the largest and the most prominent, as well as the most superficial gluteal muscle, and that is the gluteus maximus. Okay, so what are the pearls we have to bring with us about the gluteal muscles? So first, know the gluteus maximus. Then we have here the gluteus medius. Then we have the gluteus minimus. So please take note of this. Now, let's go check this out again. Let's pause for a while. Okay, give me a second. Let me reload. Let's try it out now. How about this? Welcome to our clinical anatomy coaching. We will talk about the following regions. So we have the gluteal, the thigh, and the foot region. Are the slides moving now? Okay, let me just slide through the slides and let me know if it's moving now. Okay, how about this? Are the slides moving now? Okay, great. So let's begin. Let's rewind. Okay, the beauty of technology. Okay, rewinding. Okay, so welcome to this clinical anatomy coaching. This is your med guru from CDB. This is Doc Toom. and welcome to our session this evening. Now, for this coaching session, we're going to talk about the gluteal muscles, the thigh, and the foot and the ankle region. I'll be utilizing two high-yield references. In fact, two of the most high-yield references for studying anatomy. This is Clinically Oriented Anatomy by Keith Moore and Clinical Anatomy by Regions by Richard Snell. So let's begin with the gluteal muscles. There are actually four major gluteal muscles. We have the gluteus maximus, the gluteus medius, the gluteus minimus. Then we have the tensor fasciae latae. So we have the maximus, the medius, the minimus. Then we have the tensor fasciae latae. So please take note of this. So I hope everyone got this. Now, here, these are some photos lifted from Teach Me Anatomy. This is the gluteus maximus, which is the most superficial and the most prominent of the gluteal muscles. Then we have here the gluteus maximus, which is cut, exposing the muscle underneath, and this would be the gluteus medius. So we'll go through the detail of all of these muscles. So we've mentioned gluteus maximus, then the gluteus medius, then we quickly mention the gluteus minimus. So please take note of this. Now, the last of the gluteal muscles is the tensor fasciae latae. Now, the tensor fascia latae, or the lata, okay, will actually be this muscle here, and it's going to go laterally until it inserts into what we call the iliotibial tract. Okay, now there are three gluteal ligaments. Number one, we have the posterior sacroiliac ligament. Second is the sacrotuberous ligament. Then we have the sacrospinous ligament. So posterior sacroiliac ligament, the sacrotuberous ligament, and the sacrospinous ligament. These are the three gluteal ligaments that adds support to the gluteal muscles as well as the pelvic area and the gluteal area. Now, memorize this by heart. What are the two structures that would create the greater and the lesser sciatic foramina? We have two structures, namely the sacrospinous ligament and the ischial spine. So we have the sacrospinous ligament and we have the ischial spine. So here, this is the lesser sciatic foramen. This is the greater sciatic foramen. So if you are heading to an exam, I strongly recommend that you memorize the two structures that would create the greater and the lesser sciatic foramina. So number one, we have the sacrospinous ligament. Number two, we have the ischial spine. Now, this is the greater sciatic foramen. Now, please allow me to create, okay, there. So this is the greater sciatic foramen. So I want everyone to memorize this. This is the greater sciatic foramen. Okay. Below is the lesser sciatic foramen. The greater sciatic foramen serves like a door, okay, through which all of the lower limb arteries and nerves would pass, okay? So they would leave the pelvis and enter the gluteal region. So both are important for an examination, but I would put extra effort in memorizing the greater sciatic foramen and the structures that pass through the contents of the greater sciatic foramen. Now, next, what muscle passes through the greater sciatic foramen? Okay, let's see your answers in the chat box. What muscle passes through the greater sciatic foramen? So we're asking for the muscle that passes through the greater sciatic foramen. Let's see your answers. Okay, let's see them in the chat box. What muscle passes through the greater sciatic foramen? Let's see your answers. Okay. So if this is a standard must know, level of must know, scale of 1 to 10, I give it 100. What muscle passes through the greater sciatic foramen? Okay, perfect. Okay, the muscle that passes through the greater sciatic foramen is the piriformis. Okay, please remember, this is the muscle that passes through the greater sciatic foramen. Now, there are several other structures that would exit or pass through the greater sciatic foramen. We've mentioned the piriformis, that's number 1 on the list. Number 2 is the sciatic nerve. We have the posterior cutaneous nerve of the thigh, the superior and inferior gluteal nerves, the nerves to the following muscles, the obturator internus and the quadratus femoris, the pudendal nerves, then we have the superior and inferior gluteal vessels and the internal pudendal vessels. Now, tip. If you are preparing for an exam, only memorize these 4 structures: the piriformis, the sciatic nerve, the superior inferior gluteal nerves, and the pudendal nerve. Again, if you are preparing for an exam, put extra emphasis on where the heart is. 4 structures you need to memorize by heart: piriformis, the sciatic nerve, the superior and inferior gluteal nerves, and the pudendal nerves. So if you only have 4 neurons left, memorize these 4 structures. What are these 4 structures again? Piriformis, the sciatic nerve, the superior and inferior gluteal nerves, and the pudendal nerve. Scale of 1 to 10, let's give it, okay, let's give it a scale or a rate of 100. Must know, must bring to an exam. Okay, now, what about the structures that pass through the lesser sciatic foramen? Okay, so take note, the lesser sciatic foramen has lesser structures passing there. So what I want you to remember is the tendon of the obturator internus muscle, the nerve to the obturator internus, we have the pudendal nerve, and the internal pudendal blood vessels. Now, if you only have 1 neuron left, memorize the pudendal nerve. So perfect for an exam would be the following structures: exit through the greater sciatic foramen, except take note of those 4 structures I mentioned for the greater sciatic and be familiar with these 4 structures for the lesser sciatic with special emphasis on the pudendal nerve. Okay, now, how many layers of muscles do we have in the gluteal region? There are two layers. We have the superficial and we have the deep layer. So again, the superficial and the deep layer. Now, I want everyone to remember the four muscles that comprises the superficial layer are the gluteus maximus, medius, minimus, and the tensor fascia lata. Now, if you are going to take an exam, I strongly, I reiterate, strongly encourage you to memorize whether the muscle belongs to the superficial layer or it belongs to the deep layer. Okay, so again, the four muscles of the gluteal region that belong to the superficial layer: maximus, medius, minimus, and the tensor fascia latae. So if you only have a few neurons left, okay, just remember it's the gluteal muscles plus the tensor fascia lata. These are the superficial layers. Okay, so please take note of that. Now, question: what is the most superficial gluteal muscle? Let's see your answers in the chat box. What is the most superficial gluteal muscle? So please type in your answers. What is the most superficial gluteal muscle? Let's see your answers in the chat box. Now, in any standard exam, these are the questions which you would have to know. Okay? Strike hard in these must-know questions. So the most superficial gluteal muscle is the gluteus maximus. Okay, very good. Now, follow-up question. Okay, I have a follow-up question. What is the only muscle that is not covered by the gluteus maximus? What is the only gluteal muscle which is not covered by the gluteus maximus? Let's type in those answers. Remember, the act of typing, the act of writing down things, this is an active form of learning. And what's going to happen is this is going to be stored in your hippocampus. So what is the only muscle that is not covered by the gluteus maximus? Now, be specific. What specific muscle? What specific muscle is not covered? So take note. It is the gluteus medius. It is the anterior-superior third. Okay. The anterior-superior third of the gluteus maximus. You need to be specific because the other parts of the gluteus maximus are covered. It is the anterior-superior third of the gluteus medius, which is not covered by the gluteus maximus. So again, if you are taking an exam, I would love this question. Okay, so where there's love, memorize it. So please take note of this. Now next, so here, if you notice this, look at this muscle here. This is the gluteus medius. This is the anterior-superior third of the gluteus medius, which is not covered by the gluteus maximus. Nandito yung gluteus maximus, shaded green. shaded green. So here, this is the maximus. This is the medius. If you notice, the anterior 2/3, anterior superior thirds is not covered. Everything else is covered. Now, question, what are the actions of the gluteus maximus? What are the actions? So the gluteus maximus is a very strong lateral rotator of the thigh. So pay attention to this animation here. It is an extensor and a lateral rotator. In fact, this is the only extensor of the gluteal muscles. So please memorize this. Next, it is the strongest extensor of the hip. I would put another heart in these actions. So this coaching session is full of love. It's full of hearts, with hopes that whenever you take an exam, no matter what that exam is going to be, this will put a big smile on your face. Now, identify the muscle which is shaded purple. Okay, let's see your answers. Identify the muscle which is shaded in purple. What is this muscle which is shaded purple? Okay, what is this muscle? Shaded purple? Ayan. Okay, perfect. That is the gluteus maximus. Now, what about this? What muscle is this arrow here? Okay, this is also the gluteus maximus. Okay, this is also the gluteus maximus. Now, memorize this by heart. What is the nerve supply of the gluteus medius and minimus? Okay, the nerve supply is the superior gluteal nerve. So that's L5S1. Do not even attempt to take an exam in anatomy if you don't know this. So what is the nerve supply of the gluteus medius and the gluteus minimus? It is the superior gluteal nerve. Now question, what is the nerve supply of the gluteus maximus? What is the nerve supply of the gluteus maximus? If the nerve supply of the gluteus medius and minimus is the superior gluteal nerve, what is the nerve supply of the gluteus maximus? What is the nerve supply of the gluteus maximus? Okay, so the gluteus maximus is supplied by the inferior gluteal nerve. So memorize that. So ironically, the gluteal muscles are not supplied by the sciatic nerve. Okay, even though the sciatic nerve is right there in the greater sciatic foramen. Now, this screenshot is lifted from Clinically Oriented by Moore. What disease paralyzes and causes atrophy of the gluteus medius and the gluteus minimus. It is poliomyelitis, okay, so caused by poliovirus. So the problem here is as a result of paralysis of the medius and minimus, take note, there will be an inability of the patient to tilt the pelvis when walking. So that is your clinical note. So when you encounter clinical notes or clinical correlates from the textbook, particularly clinically oriented by Moore and clinical anatomy by regions by Richard Snell, always anticipate a clinical case to come out. And they're going to ask you of the relevant anatomy or the explanation, okay, the basis for signs and symptoms as correlated with the anatomy. So there's an inability to tilt the pelvis during walking. Now, this is what we asked earlier. What is the nerve supply of the gluteus maximus? So the nerve supply of the gluteus maximus is the inferior gluteal nerve. Okay, the inferior gluteal nerve. Now, I would like to share with you a table which is lifted from a random anatomy book that came out in a recent board exam. What they gave or what they described in the question was the weakness and the movement that was affected. Okay, so let's go straight to what came out. So there's weak extension. So take note, weak extension of the hip joint. Take note, weak extension of the hip joint. That is because the gluteus maximus is paralyzed. So what nerve was injured? It's the inferior gluteal nerve. Now, what about paralysis of the gluteus medius, gluteus minimus, and the tensor fascia latae? So all three superficial muscles except for the maximus that is supplied by the superior gluteal nerve. So when there is paralysis of the superior gluteal nerve, there is loss of hip abduction. Okay, so loss of hip abduction. So I want everyone to put an important heart here. Okay. I hope everyone got that. Now, next. This is the tensor fascia lata. Look at that. Perfect. Beautiful. So identify this muscle. You should answer tensor fascia lata. So that's this muscle here. Please be familiar with this photo. That is a perfectly dissected cadaver. That's the tensor fascia lata. Now, what about the iliotibial tract? So I want everyone to memorize this. Tensor fascia lata and the gluteus maximus, okay, will form a horizontal band, which we call the iliotibial tract. Okay, so those are the two major structures, aside, of course, from the gluteal aponeurosis, the two major structures or the two major muscles that would insert and form a horizontal band known as the iliotibial tract. So please take note of that. Now, memorize this. Let's put a heart here. What does it mean if you see a heart? Do you remember or do you forget? Are you still with me? Luzon, Visayas, Mindanao. Are you still with me? What does it mean if there's a heart? Do you remember it or do you forget it? You should remember it. So the iliotibial tract receives the insertion of what two muscles? The tensor fascia lata and the gluteus maximus. Okay? So please remember that. Literally remember that. So the iliotibial tract receives the insertion of what two muscles? The tensor fascia lata and the greater part of the gluteus maximus. Please take note of this. Now, for the deep layers of the gluteal region, so apat, there's 4 superficial, 3 gluteal muscles, plus the tensor fascia lata. For the deep layer, there are also 5 muscles. Why is it 5? Because there's a superior gemili or gemellus, and there's an inferior gemini muscle. Then there's the obturator internus, the piriformis, and the quadratus femoris. Now, which deep gluteal muscle passes through the greater sciatic foramen? Let's see if you're still with me. Which deep gluteal muscle passes through the greater sciatic foramen? Which deep gluteal muscle passes through the greater sciatic foramen? It is the piriformis. Okay? So please remember this by heart. Okay? So please remember this. Okay, great. Now, this is the piriformis. It is highlighted in green. And as you can see, what is this structure here? What is this structure here where the piriformis is attached? Can anyone tell me? Okay, type in the answers. What is this structure? This is the greater trochanter. So always remember, trochanteric fractures can also cause weakness of the piriformis because the piriformis is attached to the greater trochanter. And as you can see here, let's make a dotted line here. Look at that. Perfect. This is the greater sciatic foramen. The piriformis exits, okay? It exits or it leaves the greater sciatic foramen. And as you can see, in fairness, it does appear pear-shaped. Okay? Again, I will give you a copy of the slides so you can study it. Okay? I'll share you a link. Okay? And the link, I will post the link in the community section of the announcements of the MedGuru YouTube channel. Now, this is the piriformis. Look at this. Okay. Here's the gluteus medius. Then we have here very important nerves. Okay, which we'll be discussing later. So I just want to highlight this, the piriformis, okay, the medius there. Now, please be familiar with this illustration. So this is something you must memorize. So orient yourself. This is proximal. This is caudal. What is this structure here? What is this structure here? Ano ito? Unsa ni siya? What is that? Okay, that is the sciatic nerve. Now, always remember You have two terminal branches of the sciatic nerve. Can you type in what are the two branches of the sciatic nerve? What are the two branches of the sciatic nerve? So first, we have the common peroneal. I'm encircling it right now. Then we have the tibial nerve. Actually, the common peroneal and the tibial nerve will unite here at the level of the piriformis. Okay, so we have here the tibial nerve and the common peroneal, which is also known as the common fibular nerve. So please take note, the other name of the common peroneal is the common fibular nerve. And I would like to remind everyone that damage to the sciatic nerve or the tibial nerve or the common fibular nerve, this would lead clinically to a foot drop. Okay, this would lead to a foot drop. And when would you usually expect damage to the sciatic nerve? When there's gluteal injections. Okay, now question. So this is intramuscular gluteal injections. My question is very simple. In what quadrant? Okay, you divide the gluteal region or the buttocks into 4 quadrants. In what quadrant is it considered to be safe to inject intramuscularly to avoid damage to the sciatic nerve? In what gluteal quadrant is it safe? So my question is safetiness. In what quadrant? Okay, this is known as the upper lateral or what we call the superolateral. Okay, upper lateral or the superior lateral quadrant. So superolateral or the upper lateral quadrant, that is safe to inject intramuscularly. Okay, so again, orient yourself. What muscle is this? What is this? What is this muscle here? This is the piriformis. Okay, that is the piriformis. So always remember the close proximity of the piriformis, the sciatic nerve. Now, clinical pearl, okay, is a condition known as piriformis syndrome. Always remember in piriformis syndrome, those who are predisposed are runners, bikers, dragon boat, rowers, anything with repetitive walking, climbing stairs. These are the individuals who are predisposed to piriformis syndrome. They usually have this aesthesia, okay, over the posterior thigh and the leg, so near the gastrocnemius area. So area supplied by the sciatic nerve, okay? And one way of differentiating this, okay, differentiating this from a herniated disc, okay, would be you have a positive straight leg raise test in this herniation. This is usually negative in piriformis syndrome. So please don't forget the case, okay? Now, moving on. Oh, beautiful. I want everyone to be familiar with this picture. What is muscle number 1? What is muscle number 1? Okay, look. That is the piriformis. Okay. Next, Number 9, that's the sciatic nerve. Then we have number 2, okay, that is the obturator internus. Number 7, that is the gluteus medius. Orient yourself with this illustration. Again, this is full of hearts. So please take note of that. Now, look at this very important illustration. Okay, so the must know about the sciatic nerve branches. Here, common fibular nerve, and here is the tibial. So always orient yourself, which is more lateral, which is more medial. Okay, now I'm going to share this table with you. We're going to tell you some secrets here. So first muscle is the gluteus maximus. Okay, where is it inserted? So two structures, iliotibial tract and the gluteal tuberosity. You need to memorize the inferior gluteal nerve. Action, it's the only extensor of the gluteal muscles. It also extends the knee joint. The gluteus medius, don't forget insertion into the greater trochanter. So this is the superior gluteal nerve. And if you remember, this is the thigh abductor. The minimus is also inserted into the greater trochanter. And this is also an abductor of the thigh. Now, always remember, the technical difference between the medius and minimus insertion is the medius is lateral surface of the greater trochanter. The minimus is the anterior surface of the greater trochanter. Then we have the tensor fascia latae, which is inserted into the iliotibial tract. Again, the two muscles inserted into the iliotibial tract, gluteus maximus and the tensor fascia latae, inserted in the iliotibial tract. Again, only extensor of the gluteal muscles is the gluteus maximus. Now, next, what about the piriformis muscle? So here, inserted in the greater trochanter. So look, the deep muscles. What are the deep muscles? The deep muscles, gluteal muscles, they are lateral rotators. Deep lat. Deep muscles are lateral rotators, as you can see here. So piriformis, obturator internus, the gemellus, and the quadratus femoris. So please take note of this. And what is the common insertion? Can someone tell me what is the common insertion of the deep gluteal muscles? With the exception of the quadratus femoris, because this is inserted in the quadrate tubercle. What is the common insertion structure? I put a very big heart here. What is the common structure? Type in your answer. What is the common structure which serves as the insertion? Common structure that serves as the insertion of the deep gluteal muscles. It is the greater trochanter. What is the exception? The exception is the quadratus femoris. Again, insert this in your hippocampus. What is the only deep gluteal muscle that is not inserted in the greater trochanter? Type in your answer so it will stick. What is the only deep gluteal muscle that is not inserted in the greater trochanter? Okay, what is the only muscle? Deep gluteal muscle, which is not inserted in the greater trochanter of the femur. It is the quadratus femoris. So just a hint, quadratus, quad is quadrate tubercle. Memorize that. Now, the sciatic nerve. This is the largest nerve of the body. Everyone is mandated to memorize. Okay, L4 up to S3. Again, L4 up to S3. Everyone is mandated to memorize that. The sciatic nerve is a branch of the lumbosacral plexus. It's the largest nerve of the body. So it's L4 to S3. And anatomic orientation, it is the most lateral. Okay, it is the most lateral structure which emerges from the greater sciatic foramen. So memorize that. Okay, so here, this was mentioned earlier, area which is safe for injection. Okay, that is the superolateral quadrant, this area here. Okay, this is the safe area. So let's put a smiley face here. Okay, can inject the ass there. Avoid the other areas, especially the inferior, because of the course of the sciatic nerve. Okay, now, what about the posterior cutaneous, the branches of the posterior cutaneous nerve of the thigh? There are three: gluteal, perineal, and the cutaneous branch. My question is very simple. Which branch of the posterior cutaneous nerve of the thigh would innervate or supply the back of the thigh and the upper part of the leg? It is the cutaneous nerve. Very, very important, most especially when there is history taking. Okay, now I want you to look at this. The muscles of the anterior fascial compartment of the thigh. So very nice photo lifted from Teach Me Anatomy. It's color-coded. So these are the muscles. So we have the psoas major there, which is probably the most significant muscle here, most prominent rather. Then look here at the rectus femoris. This is the rectus femoris. We have the sartorius. Okay, you can't miss the sartorius. Here's the pectineus. Then we have the vastus. Okay, the vastus lateralis. Okay, the vastus lateralis is here. Vastus medialis is not seen in this photo. Then we have the iliacus down back here. Okay, so focus on the thigh, anterior thigh, right here. These muscles here. Okay. So here, very nice cadaver. So this is your adductor here. You can't miss the great saphenous vein and gracilis, of course. This always comes out in exams. You're asked to identify this muscle. This muscle here is the gracilis. Okay. And look at the femoral vessels here. And here's your inguinal ligament. And here's the rectus femoris. Now here, just want to highlight the quadriceps femoris. Okay, so here, memorize this by heart. Do not even attempt to take an exam if you don't know the four muscles that comprises the quadriceps. Quad, so that means there's four: rectus femoris, vastus intermedius, lateralis, and medialis. So rectus plus the vastus. These are the quadriceps femoris. Now, this is a must know. Okay. Insertion of the quads is the patella through the patellar ligament. Attachment is the tibial tuberosity. That is why patellar fractures lead to weakness of the quadriceps femoris. Tibial fractures, particularly at the tibial tuberosity, would lead to weakness of the quadriceps. And what is the major action of the quadriceps? This is a very powerful extensor of the knee joint. Okay, very powerful extensor, okay, of the knee joint. So if you want to have a very strong kick, like a soccer player, you need to have a well-developed quadriceps femoris. Okay, so please take note of this. This session, this coaching session, it's going to be stored in YouTube, so you can view it anytime. Okay, and at the end of the session, I'll provide a link to the study guide for the actual slides. Okay, so here's the quads. Now, next, the femoral triangle. Oh, this is a must know. Okay, this is a must know. Okay, yeah, the session is going to be archived. It's going to be in the MedGuru YouTube channel. Okay, so here, this is a must know. So this is the famous femoral triangle. So here's the sartorius, here's the inguinal ligament, and here's the adductor longus. Memorize these three structures. So try to repeat this right now. Sartorius, the inguinal ligament, then the adductor longus. As you can see, this triangular depression here, okay, this is the femoral triangle. Now, let's go to what's going to come out in the exam. Everyone knows this is going to come out. Number one, the boundaries. Okay, so superiorly, you have the inguinal ligament. Laterally, so this is lateral, this is superior. Medially is the adductor longus. The adductor can easily be swapped for another muscle. Sartorius can be swapped to another muscle. So just memorize the superior, lateral, and medial boundaries. So whenever there is a geometric shape, okay, a triangle, okay, a quadrangle, a circle, okay, always remember boundaries and contents. So these are the contents of the femoral triangle. So it is the terminal part of the femoral nerve. We have the femoral sheath, the artery, the vein, and of course, the lymph nodes. Now, what is the arrangement of these structures? What is the arrangement of these structures? What is that famous mnemonics? What is that famous mnemonics for the arrangement of the femoral triangle contents? So please take note, we're going to have sessions for all medical school students, particularly first year, second years, and third years, as well as those taking licensure exams within the next 2 to 4 weeks. Okay. Okay. So we have the famous navel. Okay. The nerve, the artery, the vein. Okay. Then we have the lymph nodes. Okay. Perfect. Now, so here, this is your quick reminder. So we have the contents. Here's the nerve. Look at that. Here's the artery. There's the vein. Then we have the lymph nodes. Navel. Some put an E here to make it the navel. Okay, so that is medial to lateral. So please take note of that. Okay. I'll give you a copy of the slides, which are colored slides. So at least visually, it will be easier to study. Okay, now I want to introduce this very important canal. This is known as the subsartorial canal, also known as the adductor canal. The subsartorial canal or the adductor canal. Okay, so what is this subsartorial canal? So here, look at this adductor canal, this one here. Okay, so anterior medial, we have the sartorius muscle. Then we have the adductor muscle, the posterior wall. And in the lateral wall is going to be the vastus medialis. So memorize this: sartorius, adductor longus, and the vastus medialis. Again, sartorius, adductor longus, and the vastus medialis. Okay? Please take note of this. I'll be, for all of the members, we will be uploading an online link for you to have a quiz. It's a post-test quiz, which is through Google Forms. The link will be posted in the membership announcements. Okay, 25 item quiz should help you out, especially for your finals, your licensure exams. So this is the adductor canal. Would anyone happen to know the other name of this canal? It's known as the adductor canal. It's also known as the subsartorial canal. Would anyone happen to know what other famous name this canal goes by? What other name? Okay, this is known as the Hunter's Canal. Okay, also known as Hunter's. Please take note of that. Okay, Hunter's Canal. Now, here, this is going to be included in what I'm going to share with you. So this is the sartorius muscle. Okay. Take note of the nerve supply. It's femoral nerve. Okay. And this is an abductor of the thigh. Iliacus. This is also femoral nerve. This is a flexor of the thigh. So always remember, anterior compartment, these are flexors. So this is very predicted in an exam. They're going to tell you a group of muscles and they're going to give you the action. They're going to ask you for the exception. So basta anterior thigh compartment, they are flexors. Posterior are the extensors. So sartorius, iliacus, then we have the psoas. Now take note, the psoas muscle is no longer the femoral nerve. This is now the lumbar plexus. Okay, this is now the lumbar plexus. And I want everyone to memorize this. The psoas is T12 to L5. Memorize that. So let's put a little heart there. Okay. T12 to L5. Okay. Would you like a copy of the presentation so you can study it? You like a copy? You guys still awake? What time is it in your time zone? Still with me? Okay. Shout out naman. Kumusta na? How are you guys? Everyone still there? Shout out naman where you're watching right now. Okay, let's see the chat box. Take time to stretch. We're almost done. We'll be done in a few minutes. Okay, can you shout out where you are right now? Shout out from a mystical island. I'm in a mystical island right now. Okay. Where are you guys from right now? Taga-asa man mo? Taga saan? Taga-dis man mo? Okay, Cebu, North Cotabato, Tagum City. Okay, Cebu City. Bicol, wow, Tacloban. Quezon City, Pasig. Zamboanga. Shout out from Labangon, Cebu. Okay. Oh, Starbucks. Social, huh? I know, tall or venti. Okay. From Korea. Okay. Davao. La Union. Isabela. Amazing. Okay. Uh, you're in Starbucks. I'm in 38 coffee. Okay. Hindi siya 39. Hindi siya shout out to Don Macchiatos, but there's also a 38 coffee. Okay. From MOA. Wow, amazing. España, Dumaguete. Okay, so when you get a copy of this, the slides will be colored, okay? It will be printable format. Now, what about this? Here's the quadriceps femoris, and we mentioned there are 4 muscles, the vastus, 3 vastus plus the rectus femoris. Now, I want everyone to remember, when we do the reflex, which is actually L2, L3, L4, when we do the famous patellar reflex, you're actually supposed to tap the quadriceps tendon. You are actually supposed to tap the quadriceps tendon. Okay. And the normal response is going to be extension of the leg. Okay. It's the rectus femoris. Now, what about this? This is the other 3 components of the quadriceps. So vastus lateralis, medialis, and intermedius. Again, where are the quadriceps inserted? It's inserted into the patella through the ligamentum patellae. So patella, patella, patella. This is a must know, as in literally. Okay, anterior fascial compartment of the thigh share a common insertion, anterior, and that is the patella. Okay, through what structure? The ligamentum patellae. They share the same nerve supply, which is the femoral nerve. Share the same action, which is extension of the leg. Okay, so if you summarize that, basta anterior component of the thigh, we're talking thigh, not leg, inserted in the patella. Okay, that's a must know. Same nerve supply, which is the femoral nerve. Okay, and same action, which is extension. So please remember that by heart. Okay, now what about the femoral artery? So the femoral artery, yeah, look at that. Hey, don't forget the femoral triangle. Okay, so it's going to descend, going to pass through the back of the knee, and it becomes the popliteal artery. Then it's going to split, bifurcate into the anterior, okay, and the posterior tibial artery. Then you're going to have the dorsalis pedis artery there, one of the famous areas where we can feel the pulse, okay? So memorize that. Now, next, the posterior thigh muscles. I want everyone to remember the posterior thigh muscles will extend. Take note, huh? Extend the hip. So please don't mix this up during an exam. It's the hip that is extended, and what is flexed, okay, is the knee. Memorize that. It's EH, extend the hip. It's FK. It's flex the knee. EHFK. So memorize that. Okay. Now, always remember these three muscles: semitendinosus, semimembranosus, and the biceps femoris. They will share a common origin, and that is the ischial tuberosity. This will come out in exams. Okay, this will come out in exams. What is the common origin of the semitendinosus, the semimembranosus, and the biceps femoris? Long head, huh? Long head. Take note. Long head of the biceps femoris. It is the ischial tuberosity. So look, the long head of the biceps femoris. Now, I want everyone to know the action of the semitendinosus, semimembranosus, and the biceps. What do we call these posterior thigh muscles? Can anyone tell me what we collectively call them? What do we call these posterior muscles? What do we call these three muscles? Can anyone share what we call these three muscles? Very important for athletes. Okay. Runners, track and field. Okay, we call them the hamstring muscles. Okay, we call them the hamstrings. So there's hip extension, there's knee flexion. Again, E, H, F, K. Okay. E, H, F, K. And take note, the hamstrings, okay, medial rotators. So please take note of that. Now here, take note, extends the hip, flex the knee. So look at the hip extension and look at the flexion of the knee. So very important for sports, running, kicking, jogging, sprinting. Okay, very, very important. So please take note of this. Now here, I want everyone to memorize this. This is a Baker's cyst. Okay, this is a clinical correlate. This is also known as a popliteal cyst. This is usually either a continuation of the gastrocnemius or the semimembranosus. Either of these two muscles. Okay. Now, most common location, I want everyone to remember this. It's usually between the medial head of the gastrocnemius and the semimembranosus. Don't forget the two-letter M's. The Baker's cyst. Okay, please take note of that, the Baker's cyst. Okay. Now let's end up with the last. Okay. So I just want everyone to bring this home with them. Okay, the ankle joint. So here's the ankle joint. It's also known as the talocrural joint. Okay. So the ankle joint or the talocrural joint is actually comprised of two joints. We have the tibiotalar or the TTJ and the subtalar joint or the STJ. We commonly call this TTJ and STJ. Okay, the talocrural joint. is comprised of two joints. Now, question. What is the most commonly fractured bone of the foot? Okay, can anyone tell me in the chat box? What is the most commonly fractured bone of the foot? So the most commonly fractured bone of the foot, okay, is the calcaneus. Okay, so always remember that the calcaneus is usually also associated with fractures. And when there's a talar neck fracture, like what you see here, okay, fracture of the talus, this is associated with avascular necrosis. Why? Because most of the blood supply of the talus passes through the neck. Okay, most of the blood supply of the talus passes through the neck of the talus. So most commonly fractured bone of the foot is calcaneus. What is the most common fractured carpal bone? Kamay, kamot. Most common fractured carpal bone. What's your answer? Foot is calcaneus bone, huh? Bone. I did not mention tarsal bone, but bone of the foot. It's calcaneus. The most commonly fractured carpal bone is still the scaphoid. And whenever the scaphoid is fractured, you really have to take note of the radial artery. So there's usually going to be pain in the area of the anatomic snuff box, and you're going to have a weak pulse, weak radial pulse. Okay? So let's wind up this session. What is the most common joint affected by gout? Now, the most common joint affected by gout is the first metatarsopharyngeal joint. Sorry, not pharyngeal. It's kind of scary. Okay, that's literally having your foot in your mouth. Okay, not pharyngeal, but phalangeal. Okay, the first metatarsophalangeal joint, MTP. This is known as podagra. Okay. What's the drug of choice for an acute gouty attack? Acute gouty attack. What is the drug of choice for an acute gouty attack? Anyone? Drug of choice for an acute gouty attack. Let's see if you guys catch this tricky question. Drug of choice for an acute gouty attack. Okay, it is colchicine. You give a mitotic spindle inhibitor, anti-inflammatory, known as colchicine. What about chronic gout? What is the drug of choice for chronic gout? Chronic gout. For chronic gout, we give allopurinol. Okay, allopurinol for chronic gout. Okay, what if I tell you non-purine treatment of chronic gout? That would be febuxostat. And don't forget, that always comes out in biochem. What is the enzyme which is inhibited by allopurinol and febuxostat? That is xanthine oxidase. Xanthine oxidase. So always remember that. Okay, now let's wind up. What is the most commonly sprained ligament? Okay, the lower extremities, particularly the ankle. Okay, this is the ATFL, the anterior talofibular ligament. The most commonly sprained ligament of the foot is the anterior talofibular ligament. So question, is it located on the lateral or the medial aspect of the ankle? Okay, let's see your answers. Is it located in the lateral or is it located in the medial aspect of the ankle? Okay, correct answer. It is located in the lateral aspect of the ankle. Okay? So please take note of that. Now, let me share this with you before we end. This one came out in the recent boards. Prepatellar bursitis. Okay, look at this. This is the housemaid's knee. Okay, prepatellar bursitis. That is the housemaid's knee. Okay. And we also have the infrapatellar bursitis. The infrapatellar bursitis is known as the clergyman's knee or the vicar's knee, from kneeling down to pray. So infrapatellar, okay, that is the vicar's knee or the clergyman's knee. Housemaid's knee is the suprapatellar bursitis. And lastly, the unhappy triad of O'Donoghue. Career-ending sports injury, usually caused by a lateral blow, a sudden lateral blow to the knee, like what you see here. Look at this, lateral blow to the knee. So there are three structures injured here. We have the medial collateral ligament. Okay, there's a tear of the medial collateral ligament. There's a tear of the ACL, the anterior cruciate ligament, and a tear of the medial meniscus. Please memorize this. The unhappy triad of O'Donoghue. Okay, so this is what you bring home with you. The unhappy triad of O'Donoghue, usually caused by a sudden lateral blow to the knee, usually associated with contact sports like football, rugby, mixed martial arts. Three structures which are torn: medial collateral ligament, ACL, and the medial meniscus tear. Okay, so thank you everyone for hanging out with us during this session for this MedGuru CDB clinical coaching. I thank you for listening. I will be posting. I'll prepare a study guide of the session. This will be archived in the MedGuru CDB YouTube channel. You can view it as you wish. Good luck on your exams. Have a nice day. Thank you everyone for listening. This is Doc Toom, the MedGuru, saying Dagag salamat. God bless everyone. Thank you. Bye-bye.